Okay. Hello, Dr. Krishnan, and thank you for allowing our class, the Health Administration class at Governor State, to this opportunity to interview you. So, just going to give a brief description, background of your criteria. So, Dr. Krishnan is a distinguished figure in healthcare delivery science, specializing in human centered design integration. As a principal investigator, he leads research consortia funded by prominent organizations such as NIH and NHLBI, focusing on various conditions including asthma, COPD, sickle cell disease, insomnia, and COVID 19, particularly its post acute sequela. His extensive involvement in advisory groups includes positions with NIH committees, FDA, and global initiatives like the Global Initiative for Asthma, which is GINA. He has a rich teaching background, notably contributing to the American Thoracic Society's Methods in Epidemiologic, Clinical, and Operations Research MECCA program. Dr. Krishnan has been honored with numerous awards recognizing his contributions to advancing medical and respiratory care alongside delivering prestigious lectures. His academic journey includes an MD from Baylor College of Medicine, residency and fellowship at Johns Hopkins Hospital, and a PhD from Johns Hopkins Bloomberg School of Public Health. Additionally, he completed the Advanced Management program at Harvard Business School in 2022. Currently, Dr. Krishnan works at the University of Illinois Hospital and Health Sciences System. He is a physician scientist who has authored more than 250 peer reviewed publications in major medical journals, including JAMA, the New England Journal of Medicine, and the American Journal of Respiratory and Critical Care Medicine. Welcome, Dr. Krishnan, and thank you for this time to meet with our team today.
Wow, I wish my mom was here. That sounds impressive.
It is
I'm
impressive, quite
happy to be
impressive.
here. Happy to be here. All right, so Manikanta, do you get the first question? You're muted right now. I don't know if you're speaking.
Okay. Manny Kanta, can we start with Millie? Millie, can you start?
Sure thing. Dr. Question, I have a question to ask you for number two. What are the latest findings regarding the prevalence and risk factors associated with long COVID?
Wow. Okay. So first, let me start with what is long COVID, and then we can talk a little bit about how common it is. That's what prevalence means, and then risk factors basically means what are the things that makes it more likely you'll have long COVID versus not. So first, it's important to know that long COVID is a term that patients came up with. So people, not doctors or researchers, it was people who were having some trouble after developing COVID. They didn't go back to being themselves. And they got together as a community and said, this is like the symptoms, like a long tail of symptoms. This is going on longer than I had hoped. And they came up with the term long COVID. There's different definitions right now that are being used, but think of it this way. It's basically people who haven't fully recovered from the initial illness or who have developed new problems after they've had COVID that can't be because of other conditions they've already had. Okay. So that's long COVID. Long COVID can affect any part of your body from head to toe. Some of the more common problems are fatigue. So really, really, really tired, more tired than you could imagine. It could be shortness of breath, so difficulty breathing, something we call brain fog. So really having difficulty concentrating or thinking. It could also involve things like dizziness as
Mhm.
well, or feeling like your heart's going fast or slow.
Mhm.
Some people with long COVID also talk about loss of taste or smell that hasn't come back compared to where they were before. These are some of the more common symptoms, but there's about 200 symptoms. So any
Mhm.
symptom that can affect any part of the body could be part of long COVID. So that's the first thing. So that's the definition of long COVID, or really incomplete recovery or new problems that occurred after developing COVID. So if we say how common is long COVID, most studies now say that about 1 in 10 people who develop COVID go on to develop long COVID. So 1 in 10, that means most people recover, and that's the good news. I don't think we should only focus on the negative or the bad news. Most people actually do recover, but 10%, which is not a small number, don't fully recover. We think it may have been even higher prevalence when people developed the original COVID way back at the beginning of the pandemic than now. But on average, now it's about 10%. Okay. In terms of risk factors, um, we don't have a full understanding of that because there's a lot of research going on about that. And in fact, UIC is one of the hubs across the country. There's 14 hubs, but we're one of the research hubs doing research on long COVID. But based on what we can tell right now, um, the more severe COVID that you had when you were sick. So if you were hospitalized, you're much more likely to develop long COVID compared to if you're not hospitalized. Um, the second, well, actually, the first risk factor I should tell you right now is COVID. If you haven't had COVID, you can't have long COVID. Okay, so just keep that in
Okay.
mind. The more times you have COVID, the more likely you're going to get long COVID. So that's the first thing to know is you want to avoid getting COVID. It's not okay, and most people, although it's mild, some people can go on to develop long COVID. If you have severe COVID, that's also a risk factor for long COVID. And by severe, I mean people who have been hospitalized. They're more likely than those who have had COVID that doesn't require hospitalizations. The other risk factors are a little bit difficult to tell, but I think right now we think women are more likely to develop long COVID compared to men. We think people who have underlying other health conditions, like if they have bad heart disease or bad lung disease, diabetes that's poorly controlled hypertension. We think that goes on and by the way, obesity as well. So people that have, that are overweight or obese, those individuals are higher risk for long COVID. Okay, so in summary, the answer to your question is that about 1 in 10 Americans, so about 10%, is the prevalence of long COVID. And then the risk factors are having COVID. If you don't get COVID, you're not going to get long COVID. If you've had multiple COVID infections, more likely. And then there's other risk factors that I've just described. Okay, Miss Fallon.
Thank you.
Okay, Dr. Christian, you know what? I believe that for my number three, you have totally answered all. When you answered Millie's, you also answered mine. I'll read the question, but you touched every base from this question. And the question is, how do epidemiologists, physicians define long COVID, and what you did, and what are the common signs, symptoms, and long-term manifestations observed in individuals with long COVID? So you've actually touched every base there with that question that you answered with Millie as well.
Okay, thank you,
Okay.
Miss
Yes.
Fallon.
Yes, sir.
Am I passing the exam so far? Passing the
Yes.
exam. Okay,
You're doing
that's good.
amazing.
You're doing
Okay,
an excellent job.
Yes.
thank you. It's the end of the day. I'm just making sure I'm meeting Bertha's needs here. Okay. All right, Manikanta, do you have a question for me? Oh, okay. You're off screen again and you're muted. I don't know if you're on. Okay, maybe
Many,
Bertha, can we go to you if you have a
okay,
question?
yes, let's go to me. So my question is, what are the challenges in accurately diagnosing and studying long COVID, and how do researchers address these challenges?
Oh, great question. So the first challenges that we need a well accepted single definition of long COVID. And I mentioned to you that there are a range of definitions people have, and so we need to agree on a single definition. The good news is that the National Academies of Medicine is working on getting a consensus-based definition, meaning lots of people are involved in giving input, and the National Academies, which is an independent think tank of experts, are coming together to make one definition that we think we can all use. So, so that's what's happening. Um, Challenges, not only are there multiple definitions right now, but another challenge is that we don't have right now a single laboratory test we can get that says if you draw blood and this blood level is such and such, you have long COVID. And what we call that is biomarker. So we don't have a established biomarker that has good sensitivity and specificity in order to diagnose long COVID. There's a lot of research going on right now in that space, so I expect we will have that one day, but it's not here, right now. So two challenges: one, we have to agree on a definition that we use consistently, and then the second is we need some kind of a biomarker in order for us to measure it in the blood or some other place and say, once this value is above a certain threshold, that's long COVID, and we're not there yet. Right now, we're mostly depending on symptoms that people are describing to us, and that's how the diagnosis is made currently. Bertha, did you have another question?
How does the medical community treat patients with long COVID? Average duration of the treatment.
Okay, hold on one second, Manikanta. I think Bertha was asking me something first. Bertha,
Yeah.
did you ask me two questions or one? I can't remember.
No, it was just the one, and you addressed them. You addressed it. Thank you very much. So, Manikanta, yes, you can ask your question now.
Yeah. How does the medical community treat patients with long COVID? Average duration of the treatment.
Okay, excellent question. So right now, we do not have any specific treatments for long COVID. Okay, so there isn't like the treatment we have right now saying, oh, this is going to treat long COVID. What we do have is we have a lot of different treatments for symptoms because of other things. And many of those treatments work for long COVID, people with long COVID as well. So for example, one of the symptoms people get with long COVID is they have poor sleep. And in fact, some people go on to develop something called sleep apnea, which is a medical condition in which you might snore a lot and you may have choking episodes, or you may have periods in which you're not breathing at night. So that's called sleep apnea. And there are well established treatments right now for sleep apnea, not because of long COVID, but because of treatments of sleep apnea that we've already had in place. So what we tend to do as doctors right now is to, when somebody has symptoms or problems after having COVID, what we try to figure out is, are there anything we can currently treat because of treatments we've already had on the books that we've used for other conditions, and we try to bring that to help the patients today. We do know that we need to come up with better treatments for long COVID, and so one of the things that the federal government has done is they've funded um, multiple groups to conduct clinical trials to try different things that could actually that could either treat long COVID or prevent long COVID from happening altogether. So if you go to the website called recoverclinicaltrials.gov or Recover Clinical Trials, if you Google Recover Clinical Trials, you'll see 5 different clinical trials are underway right now, and UIC is one of the major centers that's participating in these clinical trials. So the short answer to your question, Manikanta, is that we do not currently have any specific treatments for long COVID, but we can help people by figuring out, are there symptoms that they have that we know how to treat for years, because we've been doing that for other conditions. And then there are specific treatments we're trying to develop for long COVID, and that's right now in clinical trial stage.
Okay, sir. Thank you.
Okay, back to you, Bertha.
Okay, Millie, we will go back to you with your next question, please.
Okay. How does long COVID impact different ages groups? and demographic? And are there any disparities in its preference and outcomes?
Can you say again? I'm not sure, Millie, I fully understood. Can you ask your question again?
How does long COVID impact different age groups and demographics? And are there any disparities in its preference and outcomes?
Okay, great. So this is a really important question, which is, what do we know about who gets long COVID, and are there some groups that are disproportionately affected by long COVID, including by age or other factors? So right now, I would say that long COVID tends to be more common among adults than in kids. We don't know for sure whether the older you are, you're at higher risk of long COVID. So that's a question mark that we don't know a good answer to. And that's part of the Recover study that UIC and other groups are trying to study right now. Um, there was some initial thoughts that as you get older, you're at higher risk, but it's not turning out that way. We're seeing in the Recover study lots of young people that have long COVID. So we think some of the earlier publications probably didn't sample a big enough population, so they didn't quite get the right numbers. So at this point, I don't know if age is really a risk factor, although I do know if you're an adult, you're higher risk than kids. That's about as much as I know right now. If you talk about, are there certain communities or certain groups of individuals who may be at higher risk, it's a little bit unclear, and let me tell you why. What we do know is that people who live in disadvantaged communities because of income or because of access to health care or because other factors that affect people's ability to manage their health, those individuals are much, much higher risk to having it, developing COVID. So you might remember during the days when COVID was around, some people were able to work from home and use computers, but not everybody. Some people actually had to go to work, had to drive a bus or work in a restaurant or deliver packages and mails. So, these individuals that had to go to work to make a living, they didn't have the ability to isolate and work from home on computers. There were people working in meat packing plants. You remember all of those stories that were there. You know, those individuals are much more likely to develop COVID. And and of course, people that work in those kind of labor type jobs tend to be individuals who are African American or Hispanic, or who have lower income or live in other disadvantaged communities. So what we know is that there are certain groups for sure who are much more exposed, let's say, to the SARS-CoV-2 virus because they couldn't isolate, and therefore much more likely to develop COVID during the terrible days of the pandemic. And what we know is that if there are many more people who have COVID, then obviously that group, there'll be many more people develop long COVID. But what we don't know is if you had 100 white people, 100 black people, all of the equal income, whether individuals who are black are more likely to develop long COVID. Okay? So said another way, we certainly know much more about that there were race differences and socioeconomic differences in risk of COVID. And obviously those groups then went on to develop more long COVID, but it's probably because they were much more likely to develop COVID to begin with. The main focus right now should be on avoiding getting COVID, even now. So even among people that are vaccinated, you do not want to get COVID. Getting vaccinated doesn't prevent you from getting long COVID. All right, so I've told you about age and I've told you about race, socioeconomic status, and ethnicity. Ms. Millie, is there another question you had? Does that answer your question?
That answered my question.
Okay, Fallon, we will go to you next with your question.
Okay, I'll ask number 6. Dr. Christian, what are the potential long-term, some of these I think you already touched base on, but it asks, what are the potential long-term health implications of COVID-19 infection, particularly in individuals experiencing long COVID? What is the case fatality rate? Is it independent on complications?
Oh boy, these questions are getting harder. You promised me, Bert, that we wouldn't have hard questions. Okay. I don't know if I can answer all of those questions,
No
Fallon. I don't
worries.
think we know the answer to all those
No,
questions,
it's understandable.
right? Yeah, but can you ask? You had multiple questions. Can you ask one of them at a time? What's the first one you had, Miss Fallon?
Sure. Um, what are the potential long-term health implications of COVID-19 infection? I think we touched base on that one already.
Yep, we did.
Then
Although, let me add, if I could, let me
sure.
add that I think I mentioned to you that it can affect any part of your body, and I told you about all of that. But something I didn't say, which I should probably say now, given the way you're asking that question, is that some people, so a subset of people with long COVID, they actually are disabled. They can't even work.
Mhm.
They can't get
Mhm.
out of the house. They can barely get out of bed. So I think that one of the long term, I mean, it's not potential, it's a real long term implication, is that some people who develop long COVID do not recover enough to actually go out and go to work or be able to go to school or to otherwise be able to take care of their family.
Mm.
And that's a small number. That's not everybody. So if 10% of people develop long COVID, it's a subgroup of that 10%,
Okay.
but it's not small. It's not a small number of people, because if hundreds of millions of people
Right.
develop long COVID, across the world, there's lots of people who are disabled because of long COVID. Okay,
Okay.
we don't have precise estimates about what what percentage of people to go on to develop disability, but it's not a small number. I just don't have a more precise number right now. Okay, so that's one. Go on
Mm.
to your next question, Miss Fallon.
What is the case fatality rate?
Oh boy, that's a very fancy question. Okay, so first let's define case fatality rate.
Sure.
Um, Case fatality rate means among the cases who have long COVID, what percentage of them die? Okay, that's case fatality rate. So among the people who have long COVID, percentage of die. I would say that we don't have a good answer to that either, Miss Fallon.
Okay.
I've never seen a good study that gives us an answer, but I would say it's a small number. Um, but I don't have a number. I can't give you a number off the top of my head. So I
Okay.
would say if 100 people have long COVID, I would say it's well below, 10%. It's probably about 1%,
Okay.
but I don't have a number beyond what I'm telling you there, because I take care of people with long COVID and I'm part of the research group, but we haven't yet published data saying, okay, here's the bottom line.
Yes.
Um, I would say in nearly every case, people with COVID don't develop long COVID. Remember, 90%
Right.
are fine.
Mm-hmm.
And I would say in most cases of people who develop COVID, it gets better over time and goes away. And then among those who are disabled and severely affected by it, it's a small percentage of that. I would say even a tiny percentage of that are the ones who are dying.
Okay.
So long COVID is not, in most cases, something that kills people. Long COVID is something that really affects their ability to go to work, go to school, go to church, and take care of their loved ones.
Okay. It's beautifully answered. The last question kind of coincided with the case fatality rate, which you have answered. Is it dependent on complications, but you answered that one. Thank you so much.
Thank you.
Yes, sir.
Okay, Dr. Krishnan, thank you for that and that answer to Fallon. Because it's very in depth, and it just made me think, is long COVID can be considered as a disability?
Yes, it can.
Okay.
Absolutely. Long
Okay.
COVID does lead to disability. There's now the federal government actually does approve disability on the basis of long COVID. You have to fill out all the paperwork. You have to have a
Mhm.
doctor that says you have long COVID, and all of the usual, difficult stuff that needs to happen. But you
Mhm.
can get disability because of long COVID. And
Mhm.
I can put the website, if you'd like, on the chat, and you
Yes,
guys can follow up on that. Okay.
yes, I would appreciate that. So then I will go on with my next question is, has the COVID-19 pandemic exacerbated pre-existing mental health conditions or triggered new ones? And what strategies or interventions have been most effective in mitigating its impact on mental well-being? And
Mm.
I can drop that in the chat for you as well if you like.
Yes, if you don't mind, that'd be great. So the first is, I should have mentioned this earlier. And so thank you, Bertha, for the really important question. I mostly focused on the physical symptoms when I talked about symptoms of long COVID, but I should have added that long COVID can also lead to either worsening or new mental health problems. I should have said that earlier because it is true. So when we talk about mental health conditions, I want to first recognize that mental health conditions are every bit as important as physical health conditions. And I think we're increasingly recognizing the importance of addressing mental health conditions. And we're not there yet. You know, as a society, we haven't quite gotten to that point. If you were to ask me what kinds of mental health conditions, I would say that, first of all, again, it can exacerbate pre-existing or it can create new ones. So both can happen. That's a fact. Okay. Now, if you were to ask me what kinds of mental health conditions, the ones that we hear about most commonly are depression and anxiety. Some people also develop panic disorder from that. And so those, I would say, are the most common ones. If you were to say what are the strategies or interventions that are the most effective, I would say, again, just as I answered earlier about how to treat long COVID to Manikanta, we don't have specific treatments for long COVID associated mental health conditions. What we do have are specific therapies that we use for mental health conditions, regardless of how they got them. And so that usually involves cognitive behavioral therapy, seeing a psychologist to help you think about what's affecting you and how best to manage that. And you can either get that through telehealth, so you don't have to go in and see somebody, or you can go in and see a psychologist in person. The other form of therapy is, depending on what the problem is that there are medications, obviously, for depression. There are obviously medications for anxiety disorder, and there are medications for panic disorder. So I would say, in terms of treatments, we're basically using the same treatments as we would even if it wasn't a long COVID associated mental health condition at this point. But we're working on how do we get more specific treatments for this. And that's why it's so important to support the Recover clinical trials.
Okay, thank you. Thank you for that. So another question with that, if someone had never been diagnosed with COVID or long COVID because of the pandemic, do you think that could have caused them to have like the mental issues, depressions, or anything? And would it be related to COVID, even though they
Yeah,
didn't have it?
yeah. No, that's that. So I did. I think I answered it, but I'll say it again in a different way.
Mm-hmm.
Um, Long COVID can make pre-existing conditions worse. So if you've had depression and now you've had long COVID, you can imagine your life is upside down. You may not be able to
Mm-hmm.
go to work. You may have fatigue. You can't get out of bed. It can affect how you think about yourself, and
Mm-hmm.
it can affect your recovery from depression. And you might actually get worse. Okay.
Okay.
So it definitely can take people with pre-existing conditions and make it worse. You can also have long COVID give de novo, so new mental health problems you didn't have at all before. So you could have been someone who gets up, goes to work every day, has a full job, comes home, takes care of the family, whatever you're doing, just as you normally do. You then develop long COVID, and some of these individuals now go on to develop new mental health conditions they never had before.
Mm-hmm.
So long COVID can do both worsen pre-existing conditions
Mm-hmm.
and trigger new ones.
Okay. Okay. Thank you. Thank you for that. Manny, do you have any other questions?
Yeah, this another one. How do epidemiologists access the effectiveness of interventions such as vaccines, antivirals, and therapeutics in preventing or treating both acute COVID-19 infection and long COVID?
Okay, excellent. So be careful driving, Manikanta. I don't know if you want to turn off your camera. I don't want you to get into an accident here.
I'm in the parking actually.
Okay,
That's
good. Yeah, that's good. Please don't drive and talk to the phone. That makes me nervous, and I'm not even driving. Okay, so and remember this is being recorded on top of that, so be careful what you're doing. Okay, so yeah, so you're asking a really fundamental question, which is, you know, we have treatments for COVID. I mean, we have a very effective vaccine for COVID. In fact, we have multiple vaccines that are very effective, and those vaccines, they don't prevent COVID. They prevent you getting really bad COVID, really severe COVID. The goal of those vaccines were to prevent hospitalizations and death. And we now have multiple vaccine options that help with that. So that's the first thing to know, is that we have effective options to prevent severe COVID. We do not have good options to prevent COVID altogether, other than staying away from people who are infected. That's the only 100% effective way. All right. The vaccines also, I would say, it's not clear to us if the vaccines prevent long COVID. It's not really clear yet. There's some data that would suggest that because vaccines reduce the risk of severe COVID, that they also reduce the risk of long COVID. Because I've already told you that if you have severe COVID, you're much more likely to develop long COVID. But I would say this is a little bit early right now, and I don't think the science is settled yet on that. Okay. So, in short, vaccines are effective in preventing severe COVID. And it makes sense that if you're lower risk of severe COVID, you're less at risk of long COVID, but we're still trying to figure it out. So I don't think we're settled on that. With respect to treatments for COVID, you're exactly right. There are multiple antivirals that we have, both biologics, you know, things that are injected in your body, as well as, you know, these are monoclonal antibodies of various sorts. We also have antivirals, you know, for example, Paxlovid, which is an antiviral agent for COVID. We know for sure that the ones that are approved by the FDA do also reduce the risk of severe COVID. So if you get one of those, you're much less likely to go on to develop severe COVID and be hospitalized. We do not know right now if those treatments, though, are effective for long COVID. Okay. And in fact, one of the studies we're doing right now at UIC, as well as other parts of the country, it's called the VITAL study, VITAL study. I'm going to type it down for you. It's part of the RECOVER program, and it's a clinical trial testing specifically Paxlovid to figure out if we give Paxlovid for either 15 or 25 days, does it actually treat long COVID symptoms? And I think they've enrolled something like 400 patients right now in that trial across the country, and they're hoping to get to about 700 in the next several months. So we will know in the next 6 months. There'll be some breaking news. And Manikanta asked the question that he's going to get an answer for in a few months, but we don't have an answer yet. So hold on tight. But the short answer is we have ways of preventing severe COVID, which is vaccines. We have ways of preventing severe COVID through medications, either biologics or antivirals that are not biologics. But we don't know yet if we have drugs or medications to actually treat long COVID. And that's part of the reason for the trials. And by the way, if you go to the web, you'll find all kinds of people saying all kinds of things, that they have new treatments for long COVID. Let's just say that most scientists, you know, serious scientists, think it's too early to tell, and I wouldn't believe what's on the web. It's the same thing that happened with COVID. Do you all remember all the crazy stuff people were recommending, and then some of those things turned out to be harmful. Some of those things turned out not to have any effect at all. So I think that we're kind of in that position right now where we don't really know. In fact, nobody knows in the whole planet, but we will know because we're involved in the RECOVER study. And so in the next 6 months, Manikanta, I can give you a better answer.
Yeah. Thank you.
All right, Ms. Bertha, I think I'm going to have to get close to finishing up here. I got to go home to my wife.
Yes, I was about to say, ask if anyone had any final questions, because we are at our time limit. And as I stated, I know Dr. Krishnan is a very busy man.
No. Right now, I'm on personal time with my wife. I'm going to get in trouble if I don't go home.
Well, that's
Oh,
very
okay.
important. So we want to make sure that you get home and not get in trouble.
Exactly. I'm in my office, as you can tell, so I got to get
Yes,
out of here pretty soon. Okay.
you're in the Mile Square.
I am in Mile Square. Yes,
Okay.
ma'am.
Yes.
Yes.
So, Doctor, if no one else has any further questions,
I
Dr.
do.
Okay, go ahead. I'm sorry.
Just a second,
Okay,
I have.
this is made me hurry up. How can individuals who have recovered from COVID-19 reduce their risks of developing long COVID, and what support and resources are available for those experiencing pre-possessing symptoms?
Okay. So, boy, that's a great question. So these are people who have recovered from COVID. Is that right?
Mm-hmm.
Okay.
Yes.
So if they've recovered fully from COVID, Ms. Millie, you might know this, and I want to make sure everyone else knows this too. That doesn't mean you can't develop long COVID, a few months later. So just because
Okay.
you've recovered fully, you can still go on to have new problems that crop up later that you never had before. So that's the
Right.
first thing, is that you are still at risk of long COVID, even if you get over the actual COVID infection. I'm sorry, Ms. Bertha, but
I'm
that's the
sorry, I
facts.
didn't know that. So thank you.
What?
I didn't know that if you had got over COVID and was better, that down the line
Yeah.
you could still get long COVID.
Yes, ma'am. That's why I'm saying don't get
Mhm.
COVID. Don't
Mhm.
get bold out there and say I'm all vaccinated. I can do whatever I want. Well, I don't think so. I wouldn't do it. Anyway,
Yeah.
so the first thing is Ms. Millie pointed out, I think appropriately, that you can get long COVID even after you've recovered, and we don't exactly know how often that happens, but we know it happens. I've seen patients like that got over it, and then like a few months later, all these new problems happen, and I have no idea why they developed it, except it's got to be long COVID. Okay,
Okay.
all right, so that's number one. What I would do is, most doctors do not know about long COVID because it's a new condition. Okay, just like most nurses don't know about it, most pharmacists don't know about it. It's a new condition. So when things are new, you should go to centers that have established long COVID clinics. That's what they do day in and day out. You should go to those centers. And the reason is those centers have thought about it. They're aware of how to make a diagnosis. They may recognize that oftentimes people with long COVID need multiple types of doctors. They may need a psychiatrist, they may need a neurologist, they may need a pulmonologist, they may need a cardiologist. So you often need multiple types of doctors because long COVID can affect various parts of the body. So my recommendation to you is that if you fully recovered and then you go on to develop these weird symptoms you've never had before, and this is not you,
Mm-hmm.
you should go talk to your primary care doctor first, because that's always the right answer first. Go talk to your primary care doctor and then ask them, am I having long COVID or is this something else? And if they say, oh, this is easily treatable, here's the problem, then let's go for it. But if they say, I don't really know, I'm not sure what to do, then you should ask them, can you refer me to a long COVID clinic? And let me see if I can give you all a list. Well, first of all, UI Health obviously has a long COVID clinic. So I'm going to see if I can give you a link to that. But we're not the only ones in Chicago. Northwestern has it.
Okay.
And
Northwestern.
Advocate Health has it,
Yeah.
other places. So you just look up long COVID clinics on Google, and you'll probably be able to find things. But let me see if I can help you even more by.
Okay.
Hold on, I'm going to try to help Miss Millie here because she's asking the tough questions. Even though I told Bertha not to ask hard questions. Now I know. Next time Bertha asks me for something, I'm like, I don't know. Okay. Well, let's see. Study people, community engagement, study reports, future plans, more resources. Ooh. Okay, there we go. Okay, so I'm gonna put something down. Okay, can you all can I share my screen?
Yes.
Yes.
Okay, so I'm gonna share my screen. And do you see something
Yes.
that says more resources? Okay.
Yes.
This is in the link recovercovid.org FAQs more, and I put that link in the chat.
Okay. I have
Thank
it.
Okay.
you.
If you click on that, you'll come to this.
Okay.
Notice what's here. under more
Okay.
resources, is
Okay.
are there experts working on, so there's some places we can read about experts. Where can I find out about disability coverage? There's stuff going on
Okay.
in this website. Where can I share my story? So, you may have something where you want to learn more and you want to click on here and say, hey, keep me posted. Put me on your newsletter list. And then it talks about vaccines. And then I think there's something about where can I go get care? Let me see if I can find it here. There we go. Survivor. Okay. So where can I go? Where can I find long COVID medical treatment in my area? Okay. If you go to the Survivor Corps website, which I will link for you as well.
Okay.
These are, by the way, rock solid, trustable links. I'm not giving you things that I would do this for myself or for my family members. So you can use this
Okay.
one. Okay.
Mm-hmm.
So if you go to this place, there's actually a place where you can say, see if I can find it here. Oh, look at that. There's a map. Y'all see that?
Okay.
Okay.
Yes.
And what state are we in, Miss Millie?
Illinois.
Okay, Illinois. All right. So you want me to click on Illinois?
Yes.
Okay. All right. We'll click on that. So Illinois. So now it says we're not endorsing anybody. We're just telling you where you can go. So you can look it up.
Okay.
So you've got advocate. There you go. Okay. And then they better have UI Health. I'm going to get riled up here. They got Jesse Brown, University of Chicago,
Mm-hmm.
Northwestern,
Mm-hmm. Okay.
Shirley Ryan, UI Health.
There
I
we
don't know
are.
why we're at the bottom of this thing, but we're down there.
Right.
Okay. It's like, what's going on? So you can click on that, and
Mm-hmm.
then it tells you more about it. You can even make a phone call and talk to a patient care navigator if you want. Okay. So
Mm-hmm.
that's where I would go to find out. Those are because it's being vetted past a patient organization and it's been reviewed by the NIH Recover people. Those are reasonable places to go first.
Okay.
Okay.
All
Thank
right,
you
Ms.
so
Thank
much,
Martha.
you.
Dr. Krishnan.
Okay.
I hate to do this to you, but we have just one last question. If you can just answer that, it's really important. What is the current scientific understanding of epidemiology of COVID-19, including transmission dynamics, risk factors for severe disease, and populations most affected? Real quick, if you can answer that.
You talking about COVID or long COVID now? That's
Just
COVID.
COVID.
Okay, got it. So right
I
now,
put it in the chat.
yeah. So right now, I would say that we are past the pandemic emergency or pandemic health emergency due to COVID. I think the federal government back in May, I believe, of 2023, said that we're now past that. That
Right.
doesn't mean that there's no COVID out there. It just means it wasn't it's gone down and is part of everyday life now. And I would say that our hospital is not full of COVID. It now has a few patients every day, but not hundreds of patients like we had before. So I would say that it's now in the endemic phase. That's ENDEMIC, endemic, which means it's just part of everyday life. It's around. People are going to get it, but it's low case counts. It's not crazy numbers like it was before. So that's the phase of, I would say of COVID that we're in. We're in the endemic phase. It's just like catching the flu. Like, can you catch the flu? Sure you can, but we're not having global flu outbreak where people are all in the hospital, right?
Mhm.
Okay. And then you asked me, how can you prevent that? Is that right? COVID? That was a long question, Ms. Bertha. I'm going to have to charge you overtime on this one. Long one.
Tell your
Transmission
wife I make
dynamics.
her
So
a cake.
transmission dynamics are pretty straightforward. Basically, if you're around somebody who is sick with COVID and you stay with them for more than, 20, 30 minutes in a small room, you're probably going to get COVID. Okay. So I think you've got to be smart and not hang out with people who have COVID. I know that sounds ridiculous, but I know people just do that anyway. They're like, well, I'm vaccinated. What's the big deal? Well, the big deal is you can get long COVID, and then you will know that you shouldn't have done this. So I think the issue is, be smart by avoiding unnecessary prolonged contact with people who have COVID. Okay. Like if you got to take care of your son or daughter or husband, like you got to do what you got to do. But I just mean if you can avoid it, be smart. Be smart about it. Do what you can. And if you have to be around people like that, wear a mask. And if you're going to wear a mask, I would recommend the KN95 mask. It's much more effective than the regular surgical masks. And the N95 masks, which are even more effective, it's just uncomfortable. You can't wear that very long. So I would say that's what I do in clinic. I'm not telling you anything I don't do already. I'm doing the same thing. If I go to clinic, I wear a KN95 mask. That's because I got to be there. People are coming in coughing all over me. I can't leave, so I might as well wear a mask and do what I can. And I wear a mask. And I haven't, knock on wood, I haven't had COVID from being in clinic. Okay. So, and I know that's a controversial topic, wearing masks, but the truth of the matter is, if you're in a high risk environment, masks work.
Yeah.
If you're outside and nobody around you has COVID, it's silly to wear a mask. There's no, you're not going to get infected. So it just depends on your level of risk. And then risk factor for severe disease. Well, the main risk factors are existing comorbid conditions and not getting care early enough. So delays of care is a major issue because we know if you can get treated early enough with Paxlovid or some of the biologics that Manikanta was talking about, you can actually prevent severe COVID.
Okay.
Okay.
Okay, Dr. Krishnan, that was our final question. We are not going to prolong you any longer.
Okay. Do I get a plaque? Do I get a plaque or a certificate?
I'll figure something out for you. But we want to thank you. We truly, truly appreciate your time and for giving us this opportunity to meet with us. It was very, very informative, very valuable information, and I'll definitely let you know how we do on our project.
Wonderful. I would love to see if you guys are you putting a poster or a report together, or what are you doing?
We have to put together a PowerPoint.
Okay. If you'd like, and only if you'd like, send me your PowerPoint, a draft, and I'm happy to give you some comments. And you don't have to do it if you don't want to, but if you'd like me to take a quick look at it, I'm happy to take a look. Okay?
Okay,
beautiful.
Thank
Thank
you
you.
very much.
All right. Take
Thank
care,
you.
everybody. Have a good
Thank
day.
you so
care.
much. Thank
Thank
you. Be safe going home.
Thank you. You too. You all do good. Bye-bye now.
Thank you. Bye.
Manikanta, drive
Bye-bye.
carefully.
Yes,
Yeah.
drive
Bye, Millie.
carefully, Manny.
Bye,
Bye.
Bertha. Bye, Phelan.
Bye-bye, Dr.
Bye.
Kristen. Okay, guys, let me stop recording. Where's the recording?
Okay,
Okay,
I got some details.